Hello, my name is Amy Truong, and this is my project on integrating acupuncture in an FQHC, an evaluation based on the Quadruple Aim. This was a retrospective observational study looking at chart reviews between January 2020 to July 2022. The objective is to assess the outcome of the acupuncture program based on the Quadruple Aim. The study was done at Access Community Health, a FQHC in Pleasanton, California, which serves about 13,000 patients annually. Based on 2021 data, 64% of patients are in the working age of 18 to 64, 61% females, and ethnic makeup is mostly of Latinx, followed by Asians. The income of the patients are mostly 100% below FPL, and the health plan coverage source is mainly from Medi-Cal. The methods of assessing the Quadruple Aim, which is looking at patient satisfaction, provider satisfaction, health outcomes, and cost-benefit analysis. The surveys were used to assess the satisfaction level for the patients and the providers, to assess health outcome, chart review of patients' subject mean pain score before and after acupuncture based on the visual analog scale was conducted. I'll talk more about that later. Cost benefit analysis was assessed again using chart reviews as well as claims data. Between January 2020 to July 2022, there were about 500 unique patients who came in for the total of 4,073 acupuncture visits. For this study, an inclusion criteria was applied to ensure the patients who utilized acupuncture completed their treatment plan. Hence, the subjects must have had at least 4 weekly or biweekly visits and no change in their chief complaint. From this, 176 unique patients were included in the study, which equates to about 2,386 acupuncture visits. Surveys were sent to all patients who had used acupuncture during January 2020 to July 2022. 79 individuals responded, with 94% reporting at least satisfied. Of the 30 plus providers we had in clinic, only 10 responded, in which 8 reported seeing a value with acupuncture in the program or in the clinic, and 2 reporting neutral. The health outcome was measured based on the mean pain score. That was determined by the visual analog scale score per individual, which is a survey asking the patients their level of pain from 0, having no pain, to 10 with extreme pain, and the quality of life questions such as their sleep being affected or daily life activities being affected from the pain. The values from each of those questions were then averaged, and a mean pain score for the group of that particular visit were also then identified. 4 visits were the number of visits I selected because this was based upon insurance coverage. The health outcome shows a statistical significance in mean pain reduction of 2.1 or 36.2% from visit 1 to visit 4, based on the multiple comparable analysis or Newman-Coles test. Time-dependent repeated measure also confirmed a statistical significant change in the mean pain score across all 4 visit time points. The cost-benefit analysis was determined by looking at the acupuncture visits, the number of provider visits, as well as preventative emergency department visits. And this is excluding any visits that are related to acute conditions such as accidents, traumas, and also COVID-related symptoms. For the acupuncture visits, there were 4,073 new visits at a rate of $106.70 per visit. So the new revenue was then at $434,589.10. Providers' visits were based on telemed as well as in-clinic visits. And since the integration of acupuncture, there was a drop in 1158 PCP visits. This implies that these visits opened up for patients who need to see their primary care provider for other conditions such as drug management, vaccines, or other health evaluations. And this is the average rate of $180.16. So in total, seeing that there is a sustained revenue of $208,624.28. There was a 61 drop in number of preventative ED visits, with an average of ED rates costing around $2,168. This is a cost savings of $3,200,248. Altogether, this yields a financial impact of $775,461.38. So, in summary, acupuncture is an added benefit to the FQHC with positive patient and providers receptivity, improved health outcomes, and yields a cost benefit. Some limitations to the study included insufficient number of providers' response to the surveys, and due to corporate policy, there were limited data that were shared on the operational expenses. Some of the short-term goals is now to hire on a part-time acupuncturist, since there is a growing demand, and the future goals is to do longitudinal studies to study the patient's selection of care, as well as acupuncture's impact in collaborative care models with behavioral health and women's health. Thank you very much for listening to my project. I also want to give a thank you to Access Community Health for allowing me to conduct the study at their site, my academic advisor, Dr. Kalkit Huey at UCLA Center for East-West Medicine at UCLA Health, and to my professor, Dr. Martin Lee, who helped me through the analysis of this project. And lastly, to the University of Arizona Western Region Public Health Training Center for providing me with the opportunity to do the study.